Hello folks, this is Seftap Savaş and this is our conversation. Today we have a wonderful weather outside in St. John's, Newfoundland and Labrador. In this video messages, I want to tell you a little bit about what I think and what I have learned by attending a conference lately about the cancers that are increasing in incidence in young individuals. For example, colorectal cancer. Oftentimes, maybe we should start with saying that oftentimes cancer is considered very correlated with age. As the age increases, the risk for cancer increases. This is because biologically we accumulate abnormalities over time, and eventually, those cells that have those abnormalities may actually transform into a cancer cell, and this is, this can start the tumor formation. So generally speaking, as the age increases, the risk for cancer increases. Doesn't mean that there aren't other factors. There are genetic factors, socioeconomic, environmental, etc. But what has been happening recently is that many scientists have been finding that certain cancers were increasing in incidence in young individuals. For example, younger than 50. Younger than 50 is still young. Seriously, yes. So, as I said, for example, colorectal cancer, the incidence rates are increasing in young individuals. So this has a number of implications for both healthcare, but also for our population, ourselves, our loved ones, families, friends, and so on. So what are the implications? That means, oftentimes people think that cancer is the old folks' disease, but this is not true. And in some cases, we know that symptoms may be also very unspecific, so even your physician may not think that you have cancer because of your young age. But I think it's time that we shift this understanding from, cancer being an old person's disease into currently becoming also a young individual's disease. So implications are the following. For physicians, please be in the know. Symptoms may be unspecific. I know bleeding can be for many different reasons, but just because a person is a young individual does not mean that they are not at risk of cancer. So that, just remember that. And for the individuals who have something different or wrong in their bodies, please bring this to your physician. And if you still feel that something needs to be done, you will have to advocate for yourself until you get the care you deserve. Without this, unfortunately, symptoms may be dismissed because of the young age or because of the fear associated with cancer, this and that. But it doesn't change the fact. But as a matter of fact, it can actually make things worse, because we know that if cancer is diagnosed early, it can be treated more successfully than late stage cancers. So young individuals in this way are at higher risk of, for example, if they are at risk of dismissed by the healthcare providers, and if they get delayed diagnosis of their cancers, this sometimes may translate into them being actually late stage cancer patients, again, where the treatment is not as successful as early stages of cancer. So in so many ways, it's such important knowledge. Again, we will use this information to discuss with your physicians. None of my conversations here are medical advice, that. But if there's something wrong, even with your young age, please go see your physician and continue to seek for medical care until you are satisfied that everything, your symptoms have been answered. And next time, hopefully, I'll talk to you about also the screening and other implications for the senior citizens. So until then, please take care.